Okay, thank you, members. I declare the meeting now open to the public online, and all members are attending in person today. We have some apologies. We have apology from Jerry Carroll, an apology from Paula Bradshaw, and Colin McGrath may not be able to make the meeting as well. Our principal item on the agenda today is the hospital parking charges, and today we're receiving a briefing from the bill sponsor. So Aisling Riley MLA is going to brief the committee today on the principles of the hospital parking charges bill. The bill was introduced in the Assembly on the 18th of October, and second stage is scheduled for the 22nd of November. A copy of the bill and the accompanying explanatory and financial memorandum is at tab 2 of the pack. So I'd now like to welcome today Aisling Riley, MLA. Aisling, you're very welcome. Thank you. And Aisling is joined by Catherine Kelly, who has worked with Aisling and indeed previously with Fra on the development of this bill. So I would like then to go ahead, Aisling, invite you to brief the committee on your bill.
Okay, thank you very much. And first of all, can I thank you all and welcome you all to the briefing stage of my private member's bill, which is abolishing hospital car parking charges. Since I have taken over this bill, I have been engaging with people and unions who have expressed support with the bill, and I've had several comments on the difference that this would make to workers, patients and families financially. As we all know, our health workers are overworked, underpaid and are faced with this unfair additional tax of car parking charges. Some workers are paying £60 plus a week in hospital car parking charges, and this is simply unacceptable. Having to decide whether to pay the bills, whether to provide heat, put food on the table or go to work should never be a decision any worker has to make. When we talk about value in our healthcare workers, let's show that by putting that money back into their pockets. Patients and families who are already stressed because they are sick should be focused on their health and recovery as a priority and not be further burdened with the hefty hospital car parking charges. The objective of this bill, the policy objective for the abolition of hospital car parking charges, is to provide free car parking for workers, patients and their families at all public hospitals in each of the 5 health and social care trusts. Free parking at hospitals will reduce the burden on patients and visitors who are already physically, psychologically and financially impacted by the experience of ill health. Additionally, it will reduce the financial burden on health and social care hospital workers, many of whom are underpaid for their work in the health service. Abolishing hospital car parking charges will promote equality of access for rural patients and workers. Car parking charges disproportionately impact those from our rural constituencies who are largely reliant on a car for transport. For many rural dwellers, public transport connectivity to hospitals is simply not sufficient as a means of getting to work for certain shifts or access treatment for specific appointment times. Similarly, the option of active travel to work, such as walking or cycling, is not practical given longer distances to travel in most cases. In summary, free hospital car parking charges provides a fairer and a more consistent approach to car parking policy. We actioned a consultation on the free hospital car parking charges, and it ran for 8 weeks from January 8th and it closed on March the 8th, 2021. There were 842 responses in total, and all responses were submitted through the SurveyMonkey site. The consultation shows that a clear majority of the respondents agree that hospital car parking should be free for all users. Out of 677 who responded on free parking for all, only 16 respondents answered no, meaning that over 97% of respondents think hospital car parking should be free for all users. Our research has shown inconsistencies in car parking charges across hospitals and trusts. There are differences in hospital car parking charges across the trusts, but there are also differences within trusts, which are in themselves creating inequality and pay parity issues for workers, patients and their families. And let me just highlight some of those differences for you. For example, the Royal Victoria Hospital has an all-day fee of £5. The Mater Hospital costs £1 per day. Belfast City Hospital costs £11 a day. And Omagh Hospital and Primary Care Complex charges £1 for up to an hour. The disparity in these charges reveals nurses in one trust are paying more than nurses in other trusts, but also nurses within the same trusts are charged differently. Scotland abolished hospital car parking charges in 2008 and finally settled all PFI schemes in 2021. In Wales, parking at all NHS hospitals is now free. So far, we have engaged with unions, health groups and rural networks. Macmillan have called for the end of hospital car parking charges, and they called them morally wrong and unfair for those who must attend hospital for treatment, especially time-sensitive treatments. Macmillan also reported 4 out of 5 cancer patients that they surveyed were worse off because of the charges. Some reported spending up to £500 monthly. So whether you are a visitor of someone who is unwell or working flat out to care for patients, free car parking would mean one less thing for people to worry about. It would ease unnecessary financial burden. The Royal College of Nurses are fully supportive and agree with me that valuing workers is a priority, and these charges are causing real financial hardship for some of their members. Rural Women's Network also are fully supportive of the bill and agree that rural workers, patients and families are disproportionately affected by hospital car parking charges. And the main theme throughout our meetings was that these charges are causing real financial hardship for many of their members. There are existing exemptions from hospital car parking charges for patients and families for receiving radiotherapy, chemotherapy, renal dialysis. Partners and relatives can also avail of free parking if they are transporting a patient receiving treatment for any of the above. But the exemptions do not cover all areas of treatment. For example, according to Macmillan, going for associated blood work does not entitle one to free parking. So again, the issue of inconsistencies and inequality arises again. It also means that if members of the same household travel separately to visit or attend appointments, they will have to pay the car parking. Therefore, the household is not benefiting from the free car parking. So, Akarja, that's my briefing concluded on my private member's bill to abolish hospital car parking charges. And if I pass it back over to the Chair for any comments or questions. Thank you.
Okay, thank you. And I have a number of indications there already, but thank you for that, Ashley. And it is an issue that I think is it has come up at committee before. I know in recent times I had pointed out to the Minister the inconsistency around asking frontline workers to come back in off their leave over weekends and to come into a situation where they're then having to not only interrupt their leave and sacrifice their leave, but then to pay for the privilege of working. So I think it is an issue of genuine concern for frontline workers, and we have all committed that we will do everything we can to, I suppose, support and assist frontline workers, and we're very, very keenly aware of the issue of retention and recruitment of healthcare staff. But in terms of the inconsistencies that you outlined there, how will your bill address the inconsistency across different trusts, across different cohorts of people, and that type of situation?
Well, that's something that I'll note and I'll take away. When you say who's going to cover the cost, it's not for the workers. It's not for the workers to pay additional tax just to go to work. It's not for patients who are ill receiving treatment or in the process of a diagnosis. Certainly not for families to pay to visit, to be with their loved one. The executive has been prioritising health in their budget, and a budget should be set aside for this, like there is in Scotland and Wales, where they have seen the importance of free hospital car parking for all.
Thank you. So I have Carol, Orlia, and then Pam and Deborah. So, Carol.
Thank you, Chair, and thank you, Orlia and Catherine, for coming to the committee. I mean, I'll be honest, up here we don't pay for parking. You know, car parking's free for MLAs. It's also free for anybody working in the building. So, and to be honest with you, even the differences between some of the salaries in health, like for example, most of the people working in health and social care, particularly in our hospitals, are women, and they're fairly low paid, the majority of them. So I think this will make a big difference. I noted even from one of the briefings that we had from the Royal College of Surgeons and Physicians, they are really refreshingly, completely supportive of what nurses and health and social care staff are going through. So I think this is something I hope this is something that will be welcomed right across health and social care piece. So the question is, like, for example, you've given an outline of the differences in the Belfast Trust alone. So if someone is going to the city for anything other than chemotherapy or radiotherapy, they're likely to pay just themselves £11. And if they're going for, say, 2 days of treatment, or 2 days, maybe over a period of 4 to 6 weeks, that adds up to an awful lot, even for patients. So in terms of RCN, and you've give their support, you've qualified that. What about the other unions? Were they equally supportive? And you know, what did they have to say in terms of what difference it would make?
Yeah, so we have spoken to several unions. We still have another few unions that we're going to be speaking to.
Okay.
One of them in particular is Unite. I mentioned the ones that we have engaged with so far.
Yeah.
And they are largely supportive. Again, Macmillan was supportive in terms of those charges. A particular, that they had mentioned a particular family in Fermanagh who had to travel from Fermanagh to Belfast, load up the car with diesel, then you're taking into account, you know, the wear and tear of the car, and that was over a 4 and 5 day consistently going for cancer, just to go for cancer treatment. So, you know, those inconsistencies, they're definitely there. That was to go from Belfast to Fermanagh. That was to go to the Royal, which is £5 per day. If they had to go to, say, the city, you know, that's almost doubling the charges that they have to incur. And again, that's over a 5 and 6 day period. Again, over a weekly basis. So, you know, it does add up significantly.
So how would so say, for example, you know, there's obviously a need for some small infrastructure to be put in car parks. So when people go in to the car park, and they get their ticket, then they're exempt, to make sure that, obviously, you know, some of the concerns would be it hasn't been abused. I mean, the matter's £1 a day. It's close to the city centre. It's anybody using the Matter car park. It's for health and social care. It's not for anything else. It's never abused. And it's actually too small. But you know, in terms of, you know, what infrastructure, albeit small, do you think would be needed for each of the trusts to make sure that this isn't misused or abused?
Well, first of all, car parking charges have been stopped here in the north a few times throughout the pandemic.
Okay.
So it has been done, and it has been shown that it is doable. Just referring back to Scotland and Wales, parking in Scotland and Wales is regulated through automatic number plate recognition technology, which helps in the avoidance of abuse, but it's not the only answer. But that will be up to the Department of Health to look at and to decide upon. In terms of, you mentioned there, the infrastructure, people are going to the hospital because they have to.
Yeah.
You know, patients are going because they're ill, workers are going because they have to work. And our rural patients really have no other options. And infrastructure should be improved, and we should have the option for people who are capable and able to attend to hospitals via public transport, like walking, cycling, and they should be encouraged to do so. However, we can't penalise workers and patients who just don't have any other option and have to travel by car.
Thank you. Thank you, Chair.
Orlia.
Yes, thank you, Chair. And Carol sort of had touched on one of the issues that I was going to raise, or well, Aisling had touched on it in her answer, but it was around like that argument or consideration about the increase or the impact on the environment, and if by taking away these car parking charges, you'd be creating more congestion. And I'm not sure if you have looked at that or considered that, but I actually just want to say that just the fact that you've took this PMB on from McCann, and I know that you know you're only in post a number of weeks, so just want to commend you and congratulate you for that, Aisling.
Thank you.
I think it's amazing, and I also think the timing of it, there's probably no better time to be trying to introduce a piece of legislation around this, because you know, like we've just came from the chamber where we've heard about all the stresses and strains that the health service is under, but that the workforce is under as well. And at a point in time where, you know, you could be looking at losing workers, you know, and having an issue with trying to retain and recruit because of the severe pressure that it's under. I think that hopefully if you're successful in bringing this bill, that it'll give NHS workers, just a wee bit of hope that, there is people out there to try and help them and support them. And you have mentioned in your opening remarks that it's not only dealing with financial burdens, but also, like the mental burden of, having to pay for these charges, worrying about money, worrying about going to work, worrying about where you're going to park your car. So I just want to say thank you for bringing it. Thank you for your presentation. And then just, I know you had touched on it slightly there with Carl, but just around that, has there been much conversation or feedback on the environmental aspect of it?
Well, I suppose just, and going back to what I'd said, people aren't going to the hospital because, they're really going because they have to. They've been diagnosed, or they're going, they're ill, so they're going because they have to. People will not go to a hospital for any other reason. And I touched on the rural aspect before, and the family in Fermanagh in particular that we were told about. They had no other option, and there was nowhere else to get the care that they needed, so they had to travel from Fermanagh to Belfast. And you know yourself when you're getting into hospital, and you hope that you're getting in for a couple of hours, but you could be in a day or two. You could be in for up to a week and 2 weeks, and so then when you're coming out and you're hit with these charges, is an additional charge that you didn't foresee. And it can add up. It can be quite lengthy, particularly if you're in the city hospital. And to go back again, you're 100% right. We are in a workforce crisis, and we could face losing workers due to exorbitant charges exorbitant charges to go to work. And this bill, I think, would incentivise recruitment and retention of those workers instead of penalising them. Car parking charges are penny wise and pound foolish, because retaining staff would save the Department of Health considerable money. And just this past weekend, I'm sure you've all seen it, there was a social media post by one of the trusts, and they were asking any staff, and I'll quote it, "Any staff available this evening to work, please contact their patient flow team," unquote. And so we can't ask our health and social care workers to give up their free time, their holidays, their time with their family to come to work, and then hit them with a car parking charge at the end of it.
Thank you, Aurelia. And Pam, go ahead, please.
Thanks, Chair. Thank you for your attendance to the committee, and thank you for raising this subject with us. I think it's certainly worthy of debate, and certainly no one should be facing excessive car parking charges, and I certainly have great sympathy for those who are undergoing treatments and end up paying charges they wouldn't normally expect to pay, and also for staff members. And we know during this pandemic, for example, that much service happened on a regional basis, and many ICU nurses, for example, were travelling great distances in order to facilitate and work in the Nightingale. And so we understand those daily costs of travel, especially with the rise in fuel costs as well, can be very burdensome, and often either there are no car parking spaces, or they cannot afford to pay the charges that have been levied at them, and then are then forced to either bus or walk distances into residential areas after long, stressful shifts. So I completely appreciate where you're coming from with this. I would have some concerns around the idea of the bill, and I would wonder how you would look at maybe potential abuse that may come from a free parking system, possibly by other commuters. And I'm thinking of an example many years ago when I was on Antrim Council, when the car parking charges were introduced into Antrim Area Hospital. One of the reasons from the trust for that was that actually the car parking spaces were basically being taken up by people, car sharing, maybe to work, to avoid charges to their place of work, maybe in Belfast, or that type of example. So how would your bill deal with that kind of scenario to ensure that those parking spaces are available to those who most need it? And I'm also thinking about, people who are disabled or who are ill, who need good access to those hospital facilities. How could you ensure that there would be available car parking for them that's accessible? if the car parks were effectively free to all?
Yeah, like, and I think I touched on it before, when you look at parking in Scotland and Wales, which is regulated through the automatic number plate recognition technology, which would help in the avoidance of some of it. But I suppose that would really be up for the Department of Health to look into. You know, there are staff, you're right, who are having to look maybe outside of the hospital and having to walk throughout the night to get to work, but that would be for the Department of Health to look at, to see what other provisions, or if there's any additional car parks that they would be able to bring in.
Okay, and can you tell us what consideration was given to targeting the bill at certain hotspots or sites where the impact of parking charges is more acute? And would that present better value for money?
We didn't look at that, but I'm certainly going to take note of that, and I'll get back to you in writing about that, if that's okay.
Okay, Pam. Yeah. Deborah?
Thank you, Aisling, for coming to the committee. I know we're newbies, so to speak, in the Assembly, but I look forward to working with you and welcome you to the Assembly as well, if I can. I mean, yes, totally agree with some of the things that you've said there in relation to staff, and obviously coming from a rural area, I know how important this is for people who have to travel for appointments, and things like that, and particularly where staff is concerned, though I would have some reservations just in relation to some of the financial aspects of this with trusts. I mean, we see there, you know, that in 2018, 2019, you know, 7.5 million of charges. You know, there's a difference of 1.3 million that the Health Trust or the Health Department of Health are still picking up. You know, if we're to take on, you know, another 7 million, what would that mean for our health department and our budgets? You know, where will we see that million, you know, we're talking £7 million coming from to deal with those charges?
Yeah, but what I would say, and I touched on it again earlier, it's that would be for the Department of Health to look at and set money aside and budget for that. But it's not for the workers to pick up that additional tax. It's not for patients to pay to go to hospital, and it's not for any of their families who are going to visit them to pay to pick up that tab essentially. And as I said before, the executive has been prioritising health in their budget, and like I said, a budget should be set aside, like there has been in Scotland and Wales, because they have also seen the importance of the free hospital car parking, and then it touches into the workforce and that as well. And parking charges are lost income on many hard-pressed workers, and we have to create better working conditions for the workers, and showing that they're valued, and that should be a priority for us all. Like, applause for our health workers simply isn't enough, but putting that money back into their pockets should be. So it would be for the Department of Health to look into that and setting a budget aside for the car parking charges.
Okay, thank you. And I was just wondering, you know, would a review, say, of available concessions and potentially, you know, capping charges maybe be a more reasonable way forward? You know, allowing, you know, receipts to continue to support critical health services. You know, if you could maybe touch on that.
Well, I mentioned before, so there is some concessionary charges for cancer patients, but you know, but it seems to be just for cancer patients. So, you know, anybody else with long-term illnesses, maybe they wouldn't be able to, say, use the infrastructure or use public transport to get to the hospitals. Sorry, just go back onto your question there.
So it's just saying, you know, would a review of concessions and looking at that, even you were saying there about the cancer patients, you know, should we look at widening that out to other people, you know, people who have to go for more regular blood tests and things like that? Should we do that rather than have a blanket approach? Because it's following on from my previous question, you know, in relation to how much money we're looking at here.
Yeah, well, I suppose we haven't certainly, and I'll take note of that, and we'll take that back about looking at a more concession rate throughout all illnesses. But I suppose the bill is essentially to make car parking free for workers as well, and patients, and for families as well. But I'm not aware of any, if there was any other concessionary rates, but I can certainly take note and go back and look at that, and then I can let you know by writing if there was any other concessionary rates.
Okay. And just,
Yeah,
sorry,
go
can I
ahead.
just
Go
ask
ahead, Deb.
another question? Just, you were talking there about, retention and recruitment of staff, which is obviously really, really important, because if we're keeping our staff, if we're, helping them, that's ultimately going to help our health service. But do we know if parking charges is a real barrier to, recruitment and retention, particularly when you're looking at the geographical spread of the charges that you'd mentioned there? Are nurses or healthcare staff saying that, that's preventing them from working in one particular trust in comparison to another?
Yes, sorry. Yes, sorry, Catherine, if you want to come in.
So Macmillan informed us that they were aware of workers who had gone into other fields and had left their employment because of bills at the end of the month. So I'm assuming that their car parking charges would have been part of that consideration. So yes, we were informed by Macmillan that was the case, Deborah, yeah.
Okay.
And also by the Royal College of Nurses, they also said that these charges were really impacting on their members.
Okay, thank you.
Okay, thank you, Deborah. Alan?
Thanks, Chair. Certainly, yeah, I would have total sympathy with the staff and the predicament that they have having to pay for parking. And I can see how that could be managed to facilitate, the logistics could be managed to facilitate staff to have free parking. But a couple of questions around just a free-for-all, as it were. Carl had mentioned earlier there about, the potential, I suppose, abuse of commuters, maybe deciding that, somewhere like the Royal Victoria Hospital, that suits them to go on, walk on down into the city centre and to their work and avoid having to pay for parking down in the city centre. Now, my experience of hospital car parks would be probably restricted to the Royal Victoria and the Ulster, where you would routinely expect in the morning to sit in a queue that could be 30 minutes before you sort of get into the car park, and you're willing cars to come out because one coming out, there's one going in, so you're that bit closer to getting into the car park. But if there was abuse of the car parks, I'm just wondering, how would you feel the bill could manage, or what logistics do you feel could be put in place to ensure that only those who are entitled to use the hospital car park would actually use it? And the other thing I'm thinking about, free car park in town centres that have car parking charges. The idea is to facilitate a turnaround, so nobody's going to park for 3 or 4 hours and take up a valuable car parking space, but sort of to have that turnaround. And I'm wondering if it was free in the hospital car parks in a large complex like the Royal, do you think that there would be no encouragement for, say, somebody, maybe a couple of family members attending an outpatient clinic? There mightn't be an incentive for them to leave the hospital grounds quickly. They may go and have a cup of coffee or have lunch or something in the hospital cafeteria, rather than, we better get out of your car here because our hour's running out, so you create that turnaround and create spaces. So, I'm wondering, what would you do to encourage that sort of timely turnaround of people getting off the site? And do you feel that if there was the free car parking and there maybe was a slight amount of abuse, or maybe a great amount of abuse, and also that scenario that I've talked about people maybe not leaving the hospital in as timely a fashion as they could. Do you think that it could have perhaps an adverse effect on the routine of outpatient clinics, that people would be routinely turning up late for outpatient appointments and sort of, say, disrupting the routine of that department? I know the number of times I've had to apologise to the staff in the outpatients clinic for being maybe 10, 15 minutes late for an appointment because of just not being able to get parked. So you feel that there could be a knock-on impact for that. And I think Deborah's mentioned there the loss of income, I think was 7 million maybe, was that sort of the figure? Yeah. So the obviously then you feel that the health department then would have to pick that up. So it does maybe put a little bit, not a major impact in the grand scheme of things, I suppose, on the Department of Health budget. So I'm sure that could be overcome. But yeah, say sympathetic to the staff. Some reservations and concerns around a free-for-all system.
Yeah, so first of all, I think the main question there was roughly around the abuse of the car parking. And again, I've mentioned it a couple of times, it would be, you know, I've mentioned that there has been the automatic number plate recognition technology. Now that isn't the only, I'm sure that's not the only system that can be used. But we could probably certainly look at what Scotland and Wales are doing in terms of how they are regulating, because they're in, you know, Glasgow, Edinburgh and Cardiff, who are much bigger cities than what we are, and they are coping quite fine.
Do we know how they cope with it?
It's through the number plate recognition technology. That's
Right.
how they.
Yeah, and the Scottish and the Welsh report very low levels of parking abuse. So it may be worth looking at how they're managing that.
Yeah,
Yeah.
so I'll
So how does that, the number plate recognition, do you have to forewarn the hospital that you're coming and the vehicle, give the registration of the vehicle, say the day before your appointment or the day before
Well,
you
we
visit
can
the
look.
patient?
We can certainly look into exactly. It could be like a 4-hour turnaround, a 6-hour, but we can certainly look into what mechanisms that they have in place at the minute in those bigger cities. Much bigger cities than Belfast. Well, we're not just talking about Bell. We're talking about across 5 trusts, but particularly you've referenced Belfast. So we can certainly go back and look and see exactly, you know, if it's 2 hours, 3 hours, or how exactly they're regulating that. So that is something that we can. I'll take note of and we can go and have a look at. Then you'd mentioned then about the roughly about the 7 million. The car parks in Belfast at the minute are being run by private PFI schemes. And again, similarly to Scotland and Wales, they were able to buy them out or they let them run out naturally. So the private companies, they're actually regulating the car park, so they're the ones that's taking in the money. But again, that's something we can, that would really be for the Department of Health to set the budget aside. If it would ultimately be 7 million, and when you look at in terms of retention of your workforce and stuff, and potentially, you know, big recruitment drives, and it would be a fairly small price.
And how would you, as I say, the other question, how would you encourage people to leave the hospital complex in a timely fashion when they finish their formal business in the hospital? You know, if there was free car parking, even with number plate recognition, what would be to stop people saying, well, look, I tell you, well, let's go down to the shops. Sure, we're parked here and it's free. We'll come back to your car in 2 hours. Nobody's going to notice. So let's go down to the local supermarket or whatever. So again, how do you feel that could be managed?
That would probably tie back into having a look to see what is being done in those bigger cities in Scotland and Wales, you know, how they're regulating it, because it could be a case that the number plate recognition is a turnaround of 4 hours. So, but we'll go back and look at that, and we'll see exactly how it's being regulated in the bigger cities, and then hopefully we can adapt it then here in Belfast and across the 5 trusts throughout the entire north.
Yeah. Thanks, Ashley.
Thank you.
And Pam?
Thank you. Another quick one for you. I wanted to check with you whether the scope of the bill would extend beyond hospitals to other services.
This bill is entirely just to abolish hospital car parking charges.
So, would it be fairly tight that it couldn't extend to other services, or?
No, it's specifically for hospital car parking charges.
And I'm not sure if you will have an answer to this, and it's perfectly fine to come back, Aisling, on it, but are there any PFI implications here? You had mentioned in your introduction that Scotland, I think it was, had to, or did bring into an end PFI. Do we have some of those in place here that we'd have to?
Yes, we do. So most of our hospitals are PFI regulated. So, and like I mentioned, both Scotland and Wales were the same. So what they looked at, Scotland abolished their car parking charge in 2008, but the PFI schemes were just finished in 2021. So parking is now completely free from 2021. So they looked at either buying out those PFI schemes or letting them run out naturally, which then would have no additional further cost.
Okay, thank you. So I'm checking any other indications from members. I don't see anything. So I think that's members' questions for now in terms of the principles of the bill. Aisling, we'll continue to scrutinise it as it makes its way through the various stages. Do you want to say anything then by way of closing remarks yourself or Catherine?
No, I think I've covered everything. Thanks very much, and thanks for your questions. And certainly I'll go back and I'll look at the ones that were raised, and I'll get back to you on those. So thank you very much.
Okay.
Thanks, Catherine. Thanks,
Okay,
Aisling.
so listen, thank you for attending the committee today and for providing the committee with that information. Thank you. So members, the single item then on the agenda today, so just need to, the date, time and place of the next meeting is on Thursday, 18th November in the Senate chamber. Thank you, members.
Thank you.